Well, to see us out in style today, I'm delighted to welcome our closing headliner speaker, who will be talking to us on the subject of reimagining healthcare through AI, the roadmap to AI maturity. Natasha Sunderji is the global health lead at Accenture. By combining her healthcare background with in-depth experience in cross-sector partnerships, she's able to develop innovative solutions for her clients in the areas of growth strategy, business model transformation, and digital health. Natasha completed a Bachelor's of Applied Science in Biomedical Engineering at the University of Toronto and a Master's in Public Policy at the Harvard Kennedy School. Over to you, Natasha.
Thank you so much, Kate, and good morning, good afternoon, good evening to everyone that's joining today's call. As Kate shared, today I'll be talking to you about how we can reimagine healthcare through AI. So let's start by talking about AI. AI is today's defining technology and one of the greatest opportunities to transform health systems from being reactive to proactive, preventive, and even predictive. It's allowing us to reimagine how we deliver our health and care to patients, to improve outcomes, and to accelerate universal health coverage. From global pandemics to health worker shortages, the world is facing growing challenges that call for the extraordinary capabilities that AI can offer. The COVID-19 pandemic and the global response effort has really shown us how transformative AI can be. For it was an AI-driven platform, Blue Dot, that first flagged the pandemic and solidified the importance of this technology. However, if we look at many countries, they still need to build the foundational elements needed to take advantage of AI. And governments who do not invest risk widening existing health inequities in their populations. So today, as we reflect on the potential for AI for good, I hope to inspire you all around the possibilities to improve health in low and middle income countries through the use of AI, why it matters, the top use cases and exciting examples we're seeing around the world, the roadmap to AI maturity, and how we can work together as a global community to reimagine healthcare through AI. The insights that I share today are drawn from a recent report that Accenture developed with the Broadband Commission for Sustainable Development's Digital Health Working Group under the leadership of Novartis Foundation and Microsoft. So let's start now by discussing the growing and unresolved global health challenges in our world today. From increasingly drug-resistant pathogens, growing rates of obesity and cancer, to the health impacts of environmental pollution and climate change. The top threats to global health are often more dangerous for low and middle income countries than they are for high income countries. Today in LMICs, many crucial health needs go largely unmet. For example, in sub-Saharan Africa, it represents 12% of the global population, but faces 25% of the world's global disease burden. Meanwhile, it only houses 3% of the world's health workers. The doctor-to-patient ratio is really unevenly spread across the world, with roughly half of the world's countries having less than one doctor for every 1,000 inhabitants. Countries like Senegal, Mozambique, Cameroon, Cambodia, Haiti, they're all among the many countries with ratios of less than 0.2 doctors per 1,000 inhabitants, whereas in Canada, the US, we have ratios of about 2.5. Germany and Switzerland, 4.2. So simultaneously, LMICs are facing this rising tsunami of non-communicable diseases, things like cardiovascular disease, cancer, diabetes, chronic respiratory disease. Combined with the ongoing burden of infectious diseases, this is putting tremendous strain on already stretched health systems. Finally, new highly infectious diseases are threatening to expose the current health system weaknesses. The current COVID-19 pandemic just showed us how vulnerable our health systems are and the disproportionate impact that health shocks can potentially have on LMICs. Almost all countries were caught off guard by COVID-19 and really ill-prepared for adequate prevention, disease detection, response, and recovery. Given this recent experience, few in the world doubt that new highly infectious diseases will emerge again. The question is simply when and how prepared our health systems will be. Introduce AI. AI has the potential to revolutionize healthcare in low and middle income countries and help us overcome the challenges of today and tomorrow. In health, AI-powered solutions are participating in an increasing number of medical tasks, ranging from exercises commonly performed by highly skilled medical workers, like screening for breast cancer, to even routine tasks that just help to reduce their workload, like streamlining patient intake and triaging. AI capabilities in healthcare really stretch across a wide spectrum. In a 2018 report by the ITU, researchers estimated that AI in healthcare could create value of between 0.2 and 0.3 trillion based on the ways it's already being used in the sector. And if we explore the biomedical paradigms in health, 5 top use cases emerge for how AI can be applied in the sector. The first is population health. The second, preclinical research and clinical trials. The third, clinical care. The fourth, patient-facing solutions. And finally, the optimization of health operations. From a population health perspective, we're seeing an exciting number of AI-enabled predictive analytics solutions emerge. And they're really helping us to better monitor and assess the health of human populations. This in turn can allow us to better select and target public health interventions. For example, Magic Box, which was created by UNICEF's Office for Innovation. It's been using advanced machine learning to provide decision makers and frontline health workers with disease spread predictions, key response measures, and population level insights. In the preclinical research and clinical trial space, we're seeing AI technologies used to assist in drug discovery and design, and the design and execution of clinical trials. The cost of developing a new prescription drug with regulatory approval has been estimated at about $3 billion US. AI is able to speed up our understanding of diseases, which can then help us to identify suitable compounds in patients and create new clinical study design processes. This can essentially help us to bring new products to market more quickly and more cost effectively. A great example of this is the work by Benevolent AI, which is using an array of AI technologies in precision medicine to better understand the underlying mechanisms of diseases and develop personalized treatments. The company is now taking their AI technology to the fight against COVID-19, and it's turning its machine learning to consider known chemical properties and biological processes of the virus and identify new potential drugs. In clinical care, new AI-based solutions are enhancing existing clinical workflows, such as diagnosis, clinical decision support, transcription of clinical conversations, auto referrals, and even supporting precision medicine. In India, Apollo Hospitals had partnered with Microsoft's AI network for healthcare and developed an India-specific heart risk score. This is essentially allowing them to better predict cardiac disease among the general population. So using Microsoft's cloud and AI tools alongside Apollo's database and field expertise, a team of specialized data scientists and clinicians were able to build a machine learning model that was able to better predict and respond to heart risk within the Indian population. In 7 years, they collected clinical and lab data from over 400,000 patients. And what they found were novel risk factors for patients who had heart attacks without the regular indicators. They're now using their AI solution to identify new risk factors and propose new weightings to existing risk factors, which is allowing them to double the accuracy of risk scoring for cardiac patients. In patient-facing solutions, we're seeing a rise of innovations that use AI to interact directly with patients and support the delivery of non-clinical therapies, personalized health advice, and support information provision. There are a lot of really, really exciting solutions emerging in this category. One of the most exciting ones, in my opinion, is this AI-powered platform, Ping a Good Doctor. And it's aiming to provide families with a doctor, an electronic health record, and a health management plan. Based on their service model, which is internet plus AI plus in-house expert physicians, Ping An has created this network of cloud-based internet hospitals, pharmacies, and health centers. And with 315 million users, 66.9 million monthly active users, and 729,000 daily consultations, Ping An's innovative AI ecosystem is undeniably helping to address Asia's growing health needs. And especially for patients in remote communities, Ping An is providing comprehensive care where access to qualified doctors may not have existed before. Finally, AI-optimized health operations is helping to streamline back-end processes in health systems, like procurement, logistics, staff scheduling, emergency service dispatch, the analysis of medical notes, and even patient experience analysis. In Copenhagen, a voice assistant technology called Corti is being used by emergency service dispatchers. The model works by listening to emergency phone calls, and in doing so, assisting dispatchers to make a diagnosis. So Corti uses speech recognition technology to describe or to transcribe the conversation, and machine learning to analyze words and nonverbal sounds such as tone, voice, and breathing patterns. It then makes recommendations on how the emergency should be handled. So a well-trained dispatcher in Copenhagen can recognize a cardiac arrest over the phone around 73% of the time, whereas early studies on Corti suggest that AI can identify cardiac arrests 95% of the time. In short, there are really few problems in health where AI doesn't have the potential or the track record to provide new solutions and improve health outcomes. But like all technology advancements, the true potential impact will only come to those countries that start or continue to invest in quality data and concurrently build the environment and infrastructure necessary to support this new era. Just like in past technology advancements, not everyone may benefit equally. And while low and middle income countries may have the most to gain from AI's transformative potential, they may also have the most to lose. In a 2018 Broadband Commission report, The Promise of Digital Health, we had identified a number of actions for governments and network operators to take in order to accelerate connectivity. In that report, we noted the need to make connectivity available and affordable to all, particularly the underserved population segments. And in the absence of targeted inclusion measures for these populations, they are very likely to miss out on the benefits of AI in health. In the 2020 Broadband Commission report that I referenced earlier, we identified 6 areas that countries should prioritize to advance in their journey towards AI maturity: people and workforce, data and technology, governance and regulatory measures, design and processes, partnerships, and business models. So firstly, a country's workforce and educational systems are the foundations for AI in health. Developing a national curricula, building capacity within educational institutions, professional training and on-the-job training, creating a national talent acquisition and retention strategy. All of these are critical to the creation and appropriate distribution of a highly skilled labor workforce that's capable of ensuring that AI-powered solutions in health are developed appropriately and reach those that are most in need. Secondly, from a data and technology perspective, countries need to prioritize the foundations: a robust technology architecture, connectivity, access to quality and representative data, data privacy and security measures, interoperability, fair and transparent algorithms and AI models. All of these are critical to enabling AI in health. Thirdly, leadership is critical to establish the robust governance structures and regulations that are needed to ensure that AI innovations target national health priorities. There are several keys to good AI governance, including creation of a national strategy and budget, clear costing and implementation plans, privacy and security preserving regulations that put people first while balancing innovation. Fourthly, existing national health systems and clinical workflows aren't always ready to integrate AI solutions. So it's important for stakeholders to analyze the technical and user requirements and to collaborate broadly to streamline the integration of AI into health systems. Put simply, AI tools that are difficult or cannot be integrated into existing health systems have a limited or non-existent chance of adoption. Fifthly, strong partnerships and stakeholder engagement fuel AI innovation and positive health impact. And a wide network of experts are needed to make this happen. From the public and private sector to academia, civil society, all are needed to support effective goal-oriented partnerships needed to ensure AI success in healthcare, such as the partnerships needed to support data collaboratives. One of the most important things from a partnerships perspective is the partnership and high-level political support across ministries and heads of state. Finally, the economic and financial viability of the health ecosystem is essential on that road to AI maturity, as it directly determines if innovators can exist and if they can cope with the shifting demands, regulatory environments, and national health priorities. So without sustainable business models, there really are going to be no innovators. So a mature landscape requires you to consider policies that foster diversified funding portfolios, creating incentive structures for innovators, creating pathways for them to monetize their assets like data, insights, and products, and supporting commercialization strategies with vested IP rights. To create that AI enabling environment, stakeholders really need to proactively invest in all of these 6 areas. And it's important that all areas are invested in concurrently because they are all important and work together to create the ecosystem necessary to appropriately design, scale, and sustain AI solutions in health. Really, AI is more than hype. It's real, it's achievable, and it's coming whether we are ready or not. AI is this true leapfrogging technology, and it is set to transform health systems and has the potential to save countless lives. So we as a global community have an opportunity here, an opportunity to actively re-engineer health systems by reimagining how digital and AI capabilities can strengthen health and care delivery. And this is particularly relevant for leaders in low and middle income countries, given the potential of this technology to address the acute needs of our populations. Ongoing and sustained action is needed if we aim to truly harness the potential of AI in health. All of us, from policymakers, the private sector, academia, civil society, and others, we all bring a wealth of experience and knowledge, and we all have an opportunity to contribute and collaborate, which will be critical to our success. The time to act is now, and I hope you will all join me in creating that AI enabling environment that ensures health and well-being for all. Thank you.
Thank you so much, Natasha, especially for ending today on a really positive note. It's been a hugely informative day and a fabulous end to our Inspired AI series. We'd like to thank you all for joining us for this series of 9 episodes over the last couple of months. And we very much hope that we can see you in person next year. I'm going to leave the amazing Inspired Minds team to close the series, and then you can head over to the sessions area of the platform where you'll find our networking lounge open. You can use the chat on the right-hand side to start a conversation, or click in the participate button to share your audio and your camera to go live on screen. Thanks once again for taking part.